Patino here at the Cosmetic Surgical Center of Rosarito. We're going to do micro air power assisted. See how that tip vibrates? And that's what, it's like an electric toothbrush. That's the word for you. So you don't have to be jamming the instrument back and forth. And you're going to be the first ones to see what comes out of here when we do these, right? So we're going to go in here gently, right? So notice that my movements are very slow and you already can see what's coming out, right? You see that yellow, beautiful fat, right? You see that? It's almost white, look at that. So no bleeding here at the Cosmetic Surgical Center of Rosarito, but a lot of it is the fact that we do a very gentle aspiration, we wait a long time. It's a combination of things. It's what we tell the patient, not to, use any aspirin, no ibuprofen, no herbs, no buttocks. So this is just incredible. And we're going to do a fat transfer to the buttocks today. And this is precisely what's going to go into her buttocks. Just pretty much almost white fat. No blood loss, no bleeding here. It's incredible. Thank you. Wow. So what look at that, huh? But look how slow the aspiration is, This is how you obtain this. This is really, it's an easy thing to do, but you gotta find a surgeon that's not going to be doing it too fast, and otherwise there's going to be a lot of bleeding, and then you have to process that fat, and it takes time to process the fat, and it will never be this beautiful yellow fat. So that's what's going to go into her body right here. So we take our time, but look at that. And then, of course, the fat graft to the buttocks is going to last because you're not going to be losing 50 or 30% of the fat that you put in because it's all pure fat, right? To begin with, when we start. Thank you. Wow, look at that, huh? And this is not just one patient. All our patients are like this, right, Gabby?
Yeah.
Look at that beautiful fat, man. And it requires multiple things. I think this is pretty much almost a unique technique where you do this in this manner. It's just incredible. Some doctors don't even believe it, so they come here to do the workshop and to see and learn how to do this in a beautiful manner. So these yellow spots, look at these yellow spots. That's what's going to go into her body. Not red, but yellow. And that's very important. Even if you're not a doctor, you can tell that, the aspiration of this fat is incredible.
Gabby, can you lift that just a bit? There.
Yeah, look at that.
Perfect.
Beautiful, huh? Thank you. Wow. What do you think, Gabby?
Pure fat.
Pure fat is what people call liquid gold, right?
The liquid gold.
It's incredible, yeah. So yeah, I think this is the ticket right here, Thank you. Okay, so this is something that I recently learned from Dr. Alexander de Souza. He's from Brazil and he's out of Miami. And he's telling us the rule of 8, meaning that the mean arterial blood pressure should be 80 or less. So in this case it's 72, as you can see. That the heart rate is 80 or less. In this case it's 69. And also that 8 times 4 is 32. So the CO2 should be 32 or above, and in this case it's 35. And this we just learned at the American Academy of Cosmetic Surgery World meeting that we had virtually, and Dr. Alexander Earl, who is our World Association, was there, and he gave a wonderful speech on ultrasound gluteal fat transfer. He's probably the most experienced ultrasound gluteal fat transfer surgeon in the world, and we're very, very pleased to have him as our president. And I moderated that session on the Brazilian butt lift along with Dr. Chad Deal, who kindly invited me, and he was the chair for that session. And I want to thank the American Academy of Cosmetic Surgery and Dr. Kevin Dubuchet for the invitation. Thank you. Wow, look at that, man. We're almost done with the belly. And look, we're still getting beautiful yellow fat. Thank you. Wow, so we're still getting yellow, beautiful fat here at the Cosmetic Surgical Center of Costa Rica. Look at that, see? What comes out is incredible, right? So it's not just a little bit, but let me show you. The what we call the pinch test. See? Look at that. See? You see no excess fat at all. See? Incredible. See? And on this side too, no excess fat. I don't know if you can see from that angle. See that there is absolutely. Wow. So she wanted some soft high definition. And this is with no technology, so no vaser, no, just with my hands, no technology at all, no other systems like a body tight or vaser or laser, nothing like that. Thank you. Okay, so look at that, man. Incredible, huh? We're always toward the end of the procedure. And look at all the beautiful fat that's coming out. This is pretty incredible, you know, and this is what's going to go into her bottom. Thank you. Wow, look at that. So she's on her side. We're giving her an amazing waist. We're almost done with the procedure here, but wow, so look at her, huh? She already has the definition, huh? The buttocks are over here. And look at that, see? No excess fat here. Look at that, see? Incredible. Nice, beautiful waist or not?
Yes, she does.
Thank you. Wow, so what do you think? This is the other side.
Incredible.
Nice waist.
Yeah.
Very nice.
Let's see here, for example, this is what we call the pinch test. See? There's absolutely no excess, no excess fat here. Thank you. This is it. Wow, so look at these, huh? Can you follow that fat right there? This is the yellow, beautiful fat that I was talking about. Incredible. Thank you.
So right here we have the cannula. That's the instrument that the doctor is using to put fat into the buttocks. You can see it wiggling around. Down here we have the deep gluteal fascia. This is the muscle over here, which is where he doesn't want to put the fat. The superficial gluteal fascia is right up here, and then we have the skin all the way up here. So you can see this entire space right here is where he is filling in with fat. Thank you.
Go ahead and measure that space and
Awesome.
see how big that is. And we'll take a photo. Let me move the cannula back and forth, you see, so you can see.
So 18.09 millimeters.
So it's not a lot, but that's not between...
So we have right here the deep gluteal fascia, and we have the superficial, and then here's the cannula.
Yeah, okay, sounds good. That's good. Okay, so notice the, I'm going to give it a bolus there, and notice the fat, right, that's going in. It's yellow, beautiful fat. Now, can you see that on the ultrasound over there?
Totally, so you can actually see this. Alright, so right here we have the cannula. This is the instrument the doctor is using to put fat into the buttocks. Down here we have the deep gluteal fascia, which you can see from one video to another is already lower down in the imaging, so this space got bigger. That's basically what we're seeing.
Let me give her a bolus right here so you can see.
So you can see the fat coming in. You see how that line is coming down? That's because that space is being occupied by more fat now. See how it's all the way down here now? The cannula's not moving. That's in the same spot. Well, it's moving this way, but the fat's coming in, and this is being pushed down, this is being pushed up. It's pretty incredible.
That's beautiful right there, you guys. Thank you. What do you think, you guys?
Looks incredible, doctor.
Incredible, huh?
Yeah.
Look at that quality of fat.
We're doing it under ultrasound guidance. This is the way it's supposed to be. The World Association of Gluteal Surgeons has multiple training centers in the United States and abroad, and we're teaching doctors how to do this procedure safely. So the fat graph and the ultrasound guidance, so that we don't go into the muscle by accident, right? Or on purpose, whatever it is, right? So we're gonna keep it safe to avoid the pulmonary embolism, right? Thank you. Wow, so we're doing a ultrasound gluteal fat transfer on this lady. Look how beautiful she looks. We put in the fat. That fat is yellow and gorgeous, isn't it? Not a drop of blood. It's basically what I told you, right? Incredible. Thank you. Wow, this is just incredible. The whole time, we're putting gorgeous yellow fat, right? This fat has not been processed. It's not like we use any system to process this fat. This is the way it is. Ultrasound guided. Thank you. Okay, so we're toward the end, and this is where the gluteal vessels are, this area that we're injecting. We're going very superficial and looking at ultrasound. And look at the quality. Yeah, look at the quality of that fat. We're pretty much done, but look at the quality of that fat down to the very end of the procedure. It's incredible, and this fat has not been treated. In other words, we don't have any system to clean this fat. This is how we collect it, and this is how we inject it.
And what are the benefits of that, doctor?
Well, the benefit basically is that when you do this way, this is pure fat. So, there is no blood in it. So normally, whatever you put in here, you have 50% or 30% of it, it dies or it's reabsorbed, and then the buttocks shrink, right? But with us, they maintain a lot of these fat because it is pure fat. Look spread, and they pass it through a system, and they clean it and purify it, which is okay, but it's also time consuming, and it's better if it's just the fat that we take out, the fat that we put in without any processing whatsoever. This is, except the fact that we collect it on saline. We collect it on a little bit of saline so that when the fat goes in, it doesn't hit the walls of the canister, which could destroy fat cells, I guess. So it also cleans it a little bit, but you can see that when we get it out, it's yellow fat. Thank you.